Health Month, and one health topic that often gets overlooked in men is infertility. Dr. Jeremy Groll from SpringCreek Fertility is here with more on the diagnosis and the treatments. It's so good to have you on, as we just, a lot of folks in the Miami Valley, of course all around obviously, celebrated Father's Day. But there are some out there that weren't able to celebrate Father's Day, and they would essentially like to.
Absolutely, and so a happy Father's Day to everybody out there, and so that belated, but certainly at SpringCreek we're aware of all the men who do want to be dads, and so with that we have our own campaign, the Swim Strong, for the male fertility awareness.
Which I do want to show off your band here. So you have the Swim Strong band, which has the little swimmers on it. I know it's hard to see, but I love that. Where can we get those bands, by the way?
And so we can get them at the office. I actually did bring one for you if you were interested.
You did not.
So very stylish.
I'm going to put that on right now. Swim Strong. But really, this is very a big topic, and again, like we said at the beginning, something that does get overlooked, especially in men. Why do you think that is?
Well, people often think of fertility as a female issue, and so they usually focus with their gynecologist. And the treatments really are centered on inseminations and IVF, and so a lot of female treatments, and so the men do kind of get overlooked sometimes, but as you can imagine, it's half the equation, so that with infertility, about 45% have an involved male factor, and so 20% or more would actually be the sole indication or the sole problem as far as their fertility. And one of the problems with it is that it's fairly silent, and that men don't know if they have a low sperm count or not, unless we get it checked.
Right, and we're looking at some risks right there on your screen right now. As you can see, facts rather, 1 in 8 couples fertility challenged, of course.
Yes.
And this is something, again, like you said, that gets overlooked. I do want to ask you, Doc, because it's not on the screen there, but does age play a factor?
That's a great question, and we used to think unless we got into the real, 50s and 60s that we start to see some change in the count, but there is some newer data showing that even with the same counts, men in their 40s and 50s actually have a lower conception rate than men in their 20s with the same exact female partner age and sperm count. So it does play a role, and so if we're taking time to conceive, it's definitely worth to get an analysis and to get tested, because it could also be an indication of a male health problem. Men may have underlying conditions like diabetes or high blood pressure that could affect their fertility.
Yeah, there are so many factors that could affect the fertility. Real quick, we can have an analysis done at your center real quick, and tell us about that, and also tell us about storage options there.
Oh, sure. And we're right over on the corner of Alex Bell and Clio at 7095 Clio Road at SpringCreek Fertility. We have a full-service male diagnostic center doing complete semen analysis and advanced testing. But you touched on a great point with the storage, and that many men are at high-risk professions and things like military, fire, police, or they have upcoming treatments, say like cancer treatments like radiation or chemo, and they should always look into storage options because they can store samples and preserve fertility where they may end up down the road with an irreversible situation, and it's always a great safety net.
A great safety net, and a great conversation with you, Doctor. We appreciate it. Of course, you can visit him at Clio Road right there. Give it a call, 458-5084, springcreekfertility.com. Thank you so much for coming on and sharing the details. We appreciate it.